Hey, Kelly, I am so excited to welcome you to my Core Connections podcast. I know we're going to have such amazing conversation today for all of our mamas listening. We are going to be specifically talking more about breastfeeding. So everybody listening, like even if you aren't sure this is applicable for you, I would highly recommend sharing this episode with all of your mom friends because we're going to be talking about some great stuff today. So Kelly, I'm so excited you're here. Could you just share a little bit with everybody about like what got you so interested in really specializing in breastfeeding and gut health specifically with
Mm.
breastfeeding?
Yes. Well, first of all, thank you so much for having me. This is so fun. First of all, I love talking about breastfeeding. So this is an easy yes for me to be here and be here talking with you. I'm so excited. But yeah, let's talk about, how I got started. Well, let's see. I was pregnant with my first when I first fell in love with all of this, and I fell down a rabbit hole. And this was, 8 years ago now. And it really started with a question of, do I want to breastfeed or do I want to formula feed? I wasn't sure. And I was also, trying to answer questions about all of the things baby related at the time. I was, newly pregnant, newly married. We didn't have a ton of money. So I was going at things from a very cost, affected standpoint. I didn't want to spend any money on anything if I could avoid it at that time. And so when I was researching breastfeeding and formula, breastfeeding was like, the very obvious, okay, I could potentially not have to spend any money on breastfeeding my baby. And so then I started researching it some more and like just kind of studying how to do it. And I found myself falling hard down a rabbit hole of all things science related to lactation. And I got bit by that bug really early on. And I just hit the ground running and never stopped. And by the time my son was 1, I had my first certification in lactation. And I was so passionate about it that one of the providers that we were seeing at the time actually encouraged me. She was like, you have to do this. You have to do this professionally. She's like, you're so good at it. And you know so much about this already. And so I got my first certification. I started working at a clinic. And then after a while, I was working at a clinic through WIC, which is Women, Infants, and Children. And I really liked that program, but I wasn't able to do what I really wanted to do. I didn't have enough time to be with people. So I started my own private practice, and it was in my private practice that I started to notice that there were a lot of themes popping up with my clients. And a lot of those themes revolved around, feeling really insecure in what they were doing and being very concerned about, their baby's symptoms and very concerned about things like gas and their diet and even being online. And I'm sure anybody who's ever been in a mom's community, everybody asks that question of, oh my gosh, what foods do I need to give up to feed my baby? And, oh my gosh, my baby's gassy. What's happening? Do I need to give up dairy? Like, this question is, it comes up on repeat constantly. And so I started to notice that my clients who were asking that question to me in my private practice, they had one common thing, and that was they were overproducers in most cases, or they had some specific stuff that happened early on when baby was first born, or something happened during labor that affected the development of baby's microbiome inside their gut, inside their belly, which contributed to kind of like a snowball of symptoms. And those two main factors are the basis for what I see in my private practice. The main contributor to a lot of the things that we question about our babies as far as symptoms that they might have, like gas or reflux, and other just kind of general upsets and fussiness.
So, Kelly, I want to ask you this question because I know you mentioned it to me before we got recording was
Sure.
What is like the number one thing that you'd like moms to know when it comes to breastfeeding? Honestly, they're breastfeeding or even bottle feeding, right? About their baby.
Oh, yes. The number one thing that I wish every parent knew, and I think that this is one of the hardest things about parenting in general, is just don't overthink it. Don't overthink your baby symptoms, and don't fall down Google rabbit holes unnecessarily, because there are so many things that our infants do that are normal. And when we look at these behaviors and start to question that something might be wrong, it can lead us to intervening in the natural process of lactation and feeding. And for parents who are very, very early on and trying to establish lactation, this can be detrimental. And so what I mean specifically by, don't overthink, and some of these symptoms are, number one, know what's normal when it comes to infant behavior. Most people don't realize that it's normal for a baby to cry after they're done eating. And that crying in itself is actually not a hunger cue. And so we see parents who, have their babies, nurse their babies, and then baby comes off, and maybe they had a gas bubble that got trapped in their belly, and so now they're fussy. Or maybe they have a full belly, but they wanted to go to sleep and they couldn't fall asleep, and so now they're fussy. Or maybe they wanted to suckle some more, but they weren't necessarily hungry. And we know that statistically, the number one reason that breastfeeding fails is that parents think that they're not making enough milk. And the reason they think they're not making enough milk is because they're misunderstanding their baby's cues and misunderstanding their baby's behaviors and symptoms. And so they correlate baby's fussy after a feed to I'm not making enough milk. And usually one of two things happens in these circumstances. Number one, they reach for formula and supplement their baby and give them like a top up, which can lead to a lowered supply because it's taking time away from feeding. Or number two, they reach for a pump and they start pumping to increase their milk supply, and because they think that they're not making enough. And the reason why pumping too early can end up being harmful is that it can put us into a place of overproduction. And supporting parents who are overproducing is about 90% of what I do. I've built an entire business on this. Okay. And I have this business for a reason, because it can make for really, really, really miserable mamas and really sad, uncomfortable babies when we have too much milk. And it can lead to a lot of these other symptoms like gas, reflux, and really weird and scary looking poops too. Like a lot of these babies have like mucus in their stools or even blood in their stools. And these symptoms look very similar to food allergies and food intolerances.
Okay, so Kelly, I have a couple questions.
Sure.
Now that you've talked a lot about a really good stuff, I'm like, where were you when I had my 3 babies? Because I was like,
start charging people to say that to me.
I always thought I had especially with my second, a lower milk supply. My first would never even take a bottle. So she got what she got. And so she was obviously fine. So it's interesting. So question about, you were talking about, overproduction of milk. So is it the fact that baby's overeating that it's causing the symptoms, or is it the milk, like what the body has to do in order to produce so much milk that the milk quality is actually a little bit different if she has too much? I don't know. Do you get my question?
I understand what you're saying. Yes, okay. That is a good question. And honestly, the answer is yes to both.
Okay.
So we often hear people say you can't overfeed a breastfed baby. And that is true if we're talking about somebody who has a regulated supply, meaning they're not making too little, they're not making too much, they just have what their baby needs. In those cases, it's going to be really hard to overfeed that baby if you're nursing them. But if you are overproducing and you have an oversupply, when you latch your baby, that milk comes out sometimes at the rate of an ounce a minute. It's fast. and it's furious. And these feedings are often very short, under 10 minutes or so. And these babies take in a lot of milk very, very quickly. And the stomach can only hold so much milk, right? So if you fill it up really quickly, it'll kind of expand like a water balloon, right? And it'll hold that excess milk, but it'll also want to compress back down. And just like overfilling a water balloon, it's got to go somewhere, right? And that pressure on the stomach can, create that reflux, right? It can create spitting up. So for babies who are often suffering with reflux, who are breastfed, that's the first place I look, is what's going on with the actual feeding themselves in mom's milk supply. Now, if we're talking about babies who might be nursing when a mom has oversupply, and maybe they're not refluxy, maybe they're not spitting up so much, but we have some other symptoms like colic-like symptoms and a lot of gas or weird poops, for example, then we're looking more at what's going on at the start of a feeding, because when we have a very fast letdown or an overproduction of milk, again, that stomach can only hold so much milk, right? And the milk at the start of a feeding is a little bit different than the milk towards the end of a feeding. What happens during a feeding is the fat content of your milk increases gradually over time. And the milk that comes out at the start of the feeding, it tends to be higher in lactose. And what we see in these babies who are taking in a lot of, we'll call it foremilk and hind milk, right? Have you heard those terms? No, really? Okay.
No, I have not. I am not a breastfeeding expert. I breastfed all three of my kids, but and again, we have to remember my youngest is 9.
Okay.
So there's been a lot, there's like, I feel like in that almost decade since having my last little one, right? Like there's just been so much more knowledge and education and learning. And so, yeah, this is interesting.
All right. Well, foremilk and hind milk tend to be buzzwords in lactation. And if you've taken a lactation class, those words have probably come up. Or if you spend time in a mom's group, those words probably have come up. And foremilk and hind milk are terms that have been coined by researchers to describe the differences in the beginning milk and the end milk. So foremilk is the beginning milk, hind milk is the end milk. And again, with people with a regulated supply, we can just throw those terms right out the window and ignore it. It doesn't matter, right? Because I hear a lot of people are concerned, like, how do I get my baby to access the hind milk? Well, unless you're overproducing, don't worry about it, right? And I'm going to start this off by saying there's nothing wrong with either milk. That foremilk, that early milk that's first released from your body is perfect milk for your baby and contains a lot of those immune system benefits that people get really excited about. This is where a lot of the living properties of our milk live. So we want our babies to have it, but there's also such a thing as too much of a good thing, right? If all we ate were fruits and vegetables, we'd probably have a really wacky gut. But if we ate a balanced diet of fruits and vegetables and grains and proteins and all of those things, we're going to have a healthy functioning gut, right? So if you are overproducing and your milk is coming out really fast and really heavy, your baby's going to get a whole lot of that beginning milk, and they're not going to get as much milk that comes out towards the end, which is higher in fat and really soothing and coating on their bellies. So what ends up happening is they get overloaded with this foremilk, and that is what contributes to a lot of the disruption that we see in their bellies and contributes to a lot of the symptoms that we see in babies, like gas and the weird poops, and sometimes even reflux and the fussiness and the colicky-like symptoms.
Okay, so this is very interesting, especially mentioning like spit up, because I always feel like, and I don't remember, and even as you're saying the foremilk and hind milk, I'm like, well, maybe I did know, but I just forgot, because you're so sleep deprived with babies, right? You're just like, I don't know. But so with babies spitting up, because I feel like that's such a common thing. But then even the colickiness, right? I know luckily none of my kids were colicky. But I have friends who had colicky babies, and oh my gosh, it's just not fun at all. So is it possible that the colickiness is honestly from the milk supply? They're imbalanced in their gut. So I think this is really interesting. And everyone listening, they've listened to me for a while. Know I love everything comes back to the gut and gut function.
Yeah.
I with adults too, and so babies. So okay. So I hear you talking about moms that like have an overproduction, but I know I'm going to get the question of, okay, but how do I know if I have an overproduction of milk? Because that would be my big question when I was in that stage, because I always thought I didn't actually even have enough milk. I always felt like I had to eat lots of oatmeal, make sure I was drinking plenty of water. I felt like I ate so much food just to I felt like I had to eat like 2 meals at one meal just to for my body to even produce enough milk. And I remember doing, the mother's milk tea. So can I, what is your thoughts on all of that for, say, someone who thinks that they don't produce enough milk?
Got it. So I think there were 2 questions there. One is, how do you know you have too much milk? And then how do I feel about the oatmeal and the supplements?
Yes, I know. I like to ask 2 questions at one time. I apologize for that, but I have lots of thoughts going on.
I'm following you. It's good. So number 1, what I will say is that I am often very surprised when I sit down with clients to learn that they didn't know that they were overproducing when in fact they were. Some of them already know because they're, just leaking like crazy, and they, put on a haka and fill it up in 2 minutes, or in a haka, like a little silicone pump, or they're pumping on top of nursing their babies, or sometimes they're doing these things and they think these things are normal. Or sometimes they just have a large storage capacity. So they're not leaking and they're not, filling a haka or doing any of these things, but that milk is still there. So it can be really difficult sometimes to be aware that you have a fast letdown or are overproducing to begin with. Some good signs would be, watch your baby when they first start nursing. If you bring your baby on to nurse and within 10 to 30 seconds, all of a sudden they're nursing like crazy, and they cannot keep up with the flow, and they're making those clicking sounds, or they come off and they cough and they sputter, that's a pretty sure bet that milk is too overwhelming for that baby. Right. And we don't have to necessarily have an oversupply to see some of these symptoms, because a very fast initial letdown can cause the same kind of symptoms, because again, they're getting a lot of milk really quickly, and it can overwhelm and overfeed them.
Okay, so before you get to the next question, then I'm going to ask you, what do we do? What can moms do who are overproducing? Right? Do you I feel like moms that do, I hear they'll pump excess and then, store it. Some moms have so much milk. So then my question is, hearing and learning from you what I am today, I'm like, wow, I learned all this stuff, and I'm like, my babies are big, but it's all good. Share it with everyone else. So I almost feel would a mom who's making too much milk, should she actually pump a little bit at the beginning for that initial letdown? And so then baby can get more of a balance of kind of that beginning and end milk. That's just my logical common sense, trying to put it together. Am I right? Or totally off?
Well, I'm glad that you are asking this and that you said this, because that is, if you're a logical person and trying to navigate this scenario, the very first thing that almost everybody goes to. But here's the problem with doing that. The more milk you move, the more milk you make. Right? So if we are trying to get on top of this with pumping or using a haka to take the edge off, or take that extra off so it's not so overwhelming, your baby might not be so overwhelmed at that next feeding, but that's a signal to your body to overproduce more. And then we get trapped in this cycle of either always having to pump or use a haka before feeding our baby, and then just having an abundance of milk. And then that's going to set people up for the risk of getting mastitis or getting clogs. And I see this problem for a lot of the parents that I support who are going back to work, is they, try to start a stash really early. And that's what the nurses at the hospital tell everybody to do, is start pumping right away and build that stash and store all your milk in the freezer. And that can be harmful, because if you do have an oversupply and then suddenly go back to work and now all you're doing is relying on your pump to keep your milk moving, that's not as effective as your baby might have been. And it's going to set you up for getting clogs and make you more prone to having issues like mastitis. So if you suspect that you have an oversupply, number one, first thing you should do is go see somebody who can guide you through it. Do not try to manage it on your own, because there are, number one, I've never made the same care plan twice for my clients who are working through this, because the specifics of what's going on with your scenario absolutely matter. And how you manage it is a little bit different for everybody. How long you're managing it for is a little bit different for everybody. And some people will say, okay, well, I'm just going to block feed to try to manage this because I read block feeding on the internet is good. And block feeding can be beneficial, but the problem is if we block feed, we can either tank a supply too fast, or if we don't do it quite right, it's not really going to fix things and you're going to end up in this frustrating struggle. And the other thing is too, that most people do not take into consideration is that one big risk factor for overproduction is having a baby who has oral restriction. And oral restriction can mean a tongue tie or a lip tie. It can also mean restriction within their body, like fascial restriction.
Yes.
So
I had that with one of mine, and we
Yeah.
figured, and I was given not good information with the tongue tie. And I'll just say it again here for those that haven't listened. I actually, one of my kiddos and I actually had tongue tie release like 6 months ago or something like that, and lip release and all that. And I recognized that nursing was an issue because of that. But I was told that, my child would grow out of it. Well, I have since learned, no. If your child has a tongue tie, please fix it when they're a baby. And also know as they get older, you need to recheck it because they can still have some restriction. And that fascial restriction underneath the tongue can also affect how they walk. I hear of toddlers walking on their toes. My kiddos are all toe walkers, and tongue ties genetics. And so it's a genetic thing. And I'm going to be bringing on, so I did a podcast episode, which I'll link below too. So if you want to listen to more about my experience with that, but also I'm going to bring on an expert that I work with, a myofacial specialist that works with tongue ties and does all that. So we're going to go deep with babies and kiddos, as I've had amazing conversations. Kelly, you'll love it. I'll make sure to send it to you when we get it out, but I want to connect it with this too. So everyone listening, because I think this is so important. And she has opened my eyes. I thought I knew a decent amount. She opened my eyes to how much a tongue tie and lip ties and all that can affect eating for not just when they're babies and nursing, but even as they get older. It was mind blowing to me. So ladies, it's coming, and just make sure this is so all intertwined. And this is, Kelly, exactly why I wanted you on here, because I'm this is fascinating. I don't know. I just, it's so exciting to me. I'm a big believer, as you are, knowledge is power. And so when we can learn these things,
yes.
Oh my gosh. Okay. So
totally.
Back to our conversation. I know we went down a little rabbit hole, but
no, that's okay. I think we should stay in this rabbit hole for just a little bit longer, because everything that you're saying absolutely connects to what we're talking about. And, I can tell if a baby's going to struggle to latch by looking at their hips. Right. It's there because everything is connected. And when oversupply is concerned, when we are talking about correcting an oversupply or managing an oversupply, we absolutely have to rule out oral restriction. I cannot stress this enough. And I want to just shake everybody on the internet who's talking about block feeding and recommending block feeding blindly to everybody, because this is so important that I'm going to say it twice. If we reverse an oversupply and you're nursing an oral restricted baby, whether you realize it or not, you run the risk of them not being able to nurse with a regulated supply. Babies who have oral restriction, who have been, nursing this whole time, they get so used to those floodgates being open and the milk just coming and pouring for them. And often we have an oversupply because baby had oral restriction and they had to overstimulate the breast to move the milk, that it created the oversupply in the first place. So if we then all of a sudden reverse that with block feeding, that baby is not going to know what to do. And you're going to run the risk of them rejecting feeding at the breast because they don't know what to do anymore.
Well, and then your baby's going to be hungry. They're going to be starving.
Yeah.
And so then and it's just,
yeah.
And I have fascinating.
Yeah. And I will also say too, since we're on this topic, tongue tie in itself can also cause a lot of these symptoms that I was talking about earlier. Tongue tie or oral restriction, fascial restriction can cause reflux in babies. It can cause gassiness in babies. And it's from that excess air intake. And we hear a lot of the babies who have oral restriction, even when they're nursing and things are nice and slow, we very often hear little sounds like while they're sucking and while they're nursing. And that's because they're not able to maintain a vacuum seal while they're nursing. And every click and every suck is a little bit of air intake. And that air intake creates a pocket inside their bellies. And just the tiniest bit of pressure will cause some reflux.
This is, again, all this stuff I wish I would have known. So everybody listening, like you're, getting your eyes open, hopefully, to so much amazing information. So the interesting thing too, and I'll say this about tongue ties is I think a lot of people think if a baby or a child or anyone has a tongue tie, they can't stick their tongue out of their mouth, but that is very incorrect. Do not self-diagnose a tongue tie. Because I actually, when we went to our specialist, we went to in Omaha, and I was like, I suspected I had one because a lot of symptoms lined up for me. And as a kid, and my mom even said, oh yeah, I had a hard time nursing you, all this stuff. Right. I thought for sure, I was like, oh, I have one, but it's probably really mild. Mine was worse than my kids. And she was like, wow, you have compensated so well. And so when I had my tongue tie release, oh my gosh, I had to do a lot of myofascial and facial work because all of a sudden my body was like, whoa, that grounding piece let go. And now the body's like, I have to overcompensate. So the sooner you can all get your baby's tongue tie release and then also watch them as they get older, like you can prevent so many problems, sleep problems being a huge one as they get older, like feeding. Yeah. Migraines, feeding when they're little, I feel like is like the big thing, right? Everything we're talking about. But as they get older, I feel like it's sleep, but I wouldn't be surprised if sleep is also dramatically affected when they're a baby too. And that can make for a fussier baby because when they're tongue tied, their tongue is not sitting on the roof of their mouth like they're supposed to be because it takes too much effort and energy. And so when they then go to sleep, the tongue's like, I'm going to stop working so hard, and it falls to the bottom of the mouth, and they don't become good nose breathers. And their palate also can develop high, which can cause restrictions to breathing and dental issues and like all this stuff. And I'm like, my eyes have been wide open to all this. And it's just amazing how it's also interconnected, which I always talk about. So it's not really a surprise to me, but it's fascinating.
Yeah. Well, and to further comment on what you're saying is that I hear that a lot. People say, oh, well, my baby just has a mild tongue tie. There's no such thing as a mild tongue tie. And I will say this too. Even when I get babies that come into my practice that are older, and what I mean by older babies, I'm talking like 4-month-olds, right? I always look inside their mouths and I'll get comments from parents. Oh, well, we don't need to do that because my pediatrician looked and there's no tongue tie. And I'll say, well, no offense to your pediatrician, but I've not seen your baby's mouth and I just want to take a look anyway. I cannot tell you how many tongue ties I've found that were missed by pediatricians, or how many people have come to me who the provider was not fazed by it or not concerned by it because the baby was thriving. Most providers think tongue tie is a problem when baby is failure to thrive. But it's so much more complex than that, and absolutely can impact feeding. And furthermore, can absolutely impact how we feel about our feeding relationship. And the thing that frustrates me to no end about taking our baby to a pediatrician is that the pediatrician only cares about what's happening with the baby. Not all pediatricians, but most pediatricians only care about what's happening with the baby, because the baby is their patient. They don't really care about what's happening with the parent. But breastfeeding takes two, right? Our experience is just as valid and matters just as much as what's happening with the baby. And if something is going on inside a baby's mouth that's causing us discomfort or pain or overwhelm or overproduction or undersupply, it matters. And so if you're concerned about your baby having a tongue tie and your doctor is not, go find somebody else who can support you and guide you and give you an evaluation and advocate for you if you need it, because the difference in nursing a baby with a tongue tie versus a baby who's then been released is remarkable.
Yeah. This is where it's like, you have to trust your own motherly intuition. If you're like, no, I'm just not quite feeling in alignment with what the doctor is telling me, always go get another second opinion, especially if you feel like there is something a little off with nursing, or your baby is colicky, or what would be like, how amazing, Kelly, if we start to, if as a society, we start to recognize, wow, a colicky baby might have lip and tongue ties, and they're just like, they're not sleeping well because they can't breathe effectively. They're not nursing well. It's like, think about, if you're not eating well and you're not sleeping well, we're all cranky. So as a baby, the only way for them to express themselves is crying. And we have to remind ourselves that, like, so anyway, but I just think that that's so, like, what you just said is so powerful. And we need to remind ourselves and other moms, and just like, give yourself a little grace too, right? With all of this, and and trust your intuition. So, okay, Kelly, I want to make sure we get into talking. Oh, go ahead.
You asked me a two-part question, and
I did. Yes.
Totally sidelined. I want to make sure we answer this other question really quickly. You were asking about supplements, and I'm going to give you the short answer to this.
Okay, great.
Because I know you have another question. But eating things like oatmeal, and drinking mother milk tea and all of these things, we do not need them. We absolutely do not need them. The only thing we need to do the only thing we need to do to make plenty of milk for our babies is just nurse our babies. There are very rare instances where people struggle to make enough milk for their babies. Less than 5% of people have a biological reason why they cannot make enough milk for their babies, right? And in those cases where there is some sort of biological factor that is preventing us, trying to eat oatmeal in the mornings is not really going to do a whole lot for us, or taking a mother milk's tea is not going to do a whole lot for us. There's not enough ingredients in those teas and lactation cookies to have any sort of metabolic effect on our body.
That is so interesting, because I did a lot of all that with all three, because at the time,
that's what you're told.
9 to 14 years ago, when I was nursing my babies, it was like, that was the big thing. And I swear it was either maybe
huge now. There's so many products that are marketed to people, and they are gimmicks. They are gimmicks, and they infuriate me, and they prey on our fears.
Oh yeah. I hate fear mongering. It's not good.
It's fear mongering. It is. And it reinforces that idea that we are not enough. And it's wrong on so many levels. And people are making a lot of money selling these products to people who think they need it. That being said, is there any harm in drinking a mother milk tea or eating a lactation cookie or having oatmeal for breakfast? No, absolutely not. And if it's making you feel more confident in yourself and your ability, by all means, go for it. There is power in placebo, but there is very little to no evidence that any of these things work. And there is so little of these ingredients and these herbs and these properties in these cookies and teas that it's really not having any sort of metabolic effect on our bodies or any effect that could increase milk production. So yeah, I did want to touch on that. And I do have some more information about that specifically on my blog if people want to check it out and learn a little bit more about the science behind it.
Yeah, that would be
Or
great.
lack thereof.
Yeah. So Kelly, I thought it was interesting. You said that like less than 5% of women create or don't have enough milk supply, right? Because you hear about a lot of, oh,
I
go
want to
ahead.
correct that. It's not
Okay.
that less than 5% people don't have enough milk. It's actually a lot more than that. But those people, most of those people, it is environmental reasons. And it's that reason that we talked about earlier on, where we get into our heads and we overthink things and we don't know what's normal. And we think that we're not making enough milk because our baby's like crying after feeding or something like that. The 5% that I'm talking about are people who have a biological factor that would prevent themselves from producing enough milk. Like people
Okay,
who have
gotcha.
insufficient glandular tissue, or other issues like polycystic ovarian syndrome, or other issues like that. There's a few more people who might fall into this category if they've had like a breast reduction, or other trauma to their body or other like hormonal issues. But it is a very small percentage of people that physically, biologically cannot produce enough milk.
Okay, thank you for clarifying. So I would almost suspect because having worked with so many pregnant moms and pregnant and then postpartum and all of that, and
Yeah.
hearing different moms that weren't able to nurse and knowing what we talked about today already, just like checking to make sure your baby doesn't have a tongue tie because maybe they just flat out couldn't latch well, right? And I'm like, that is so eye-opening to me to think, especially for a mom who really wants to breastfeed. And it's very disheartening when you're like, but I can't. And here, okay, can I also say this? Because I, with one of mine, I don't remember which one, I think it was my first, a lactation consultant came in, and is in the hospital right after she was born and making sure I could nurse correctly. She tried to tell me that I couldn't nurse, but we had no issues. I actually had no issues with my first and my third. And so from that experience, I also just want to put out there for women, like if you work with a lactation consultant that is really negative and like a Debbie Downer, please go find somebody else, because I think you have to, like, it's like any coach or any person you work with, any doctor, anyone, like you've got to jive, like you've got to have a good energy. And if they're just
Oh,
going to be
yeah.
like really, like she was just like, I don't know what happened to her, but she was really like negative and all this stuff. And I was like, well, I clearly am nursing. My baby is eating. So I don't know what you mean by that. And it was just a very, like, as a first time mom, I was like really kind of off put by that. And so then I remember, I think with my second, then we did have trouble nursing because found out, major tongue tie. And I had the greatest lactation consultant with him, which was amazing because I was like, I got to then experience, because I was really hesitant at first to be like, I don't even know if I want to go do this, because my first experience was they just told me I can't nurse. And I'm like, okay, so what do I do about that? Like they literally just like, oh, you can't nurse. And I'm like, but she seems to be doing fine. So, and then with my second, I had an amazing lactation consultant and she did things a little different. And I remember at that appointment, the first one with her, there was another lactation consultant like peeked in and wanted to see what was going on. And she kind of like shooed her out. She's like, oh, she's really like she does like, just like very negative. And I don't know what is up with that. But anyway, that is just some weird personal experience. So again, empowering yourself, finding someone, that works well with you. If you really want to nurse and you're not liking that someone's telling you can't, go to someone else who will teach you, who will work with, it's like this whole thing I talk about all the time, working with your body. Let's learn how to help our body. And maybe at the end of the day, you can't nurse, but just going to someone and them saying no. And hopefully it's shifted a little bit more again in the lactation world. Obviously, clearly you're not like that, right? You're very all about empowering mom. Let's figure out what we can do, right, to help our body. And so anyway, because I'm all about that in every way, aspect of life. Like that's what we can do to work with the body. And let's like look at all the avenues. What might be causing struggles with nursing? Anyway, okay, so I know you want to share a little bit more about some type of supplements that that you did recommend. right? So you do recommend for moms in the
Well,
breastfeeding?
sort of. So, well, number one thing what we want to think about when we're talking about taking a supplement for breastfeeding and lactation is that, people focus more on what baby is getting, I think. And we think about, wanting to continue to take a prenatal vitamin or some sort of multivitamin to help our bodies when we're breastfeeding, which is great. Please do keep yourself healthy. You don't need to take a prenatal vitamin or a vitamin to, produce healthy milk for your baby. But what can happen is, your body will pour from your own stores. So you might be affected. So make sure that you're eating well and, take a vitamin for you. But babies are universally, pretty much, pediatricians will recommend babies be supplemented with vitamin D. And I'm also very commonly seeing that doctors are recommending babies now also be supplemented with the probiotic, right? And the thought process behind the probiotics is that probiotics are good, probiotics are healthy for our guts, and all of that. However, what I also see very commonly in the babies that I work with is that adding something into the belly that is not meant to be there can do more harm than good. And what I mean by that is the expectation after birth is exclusive breastfeeding. And when exclusive breastfeeding doesn't happen, it can cause disruption in the belly. So especially babies who might have had a little bit of formula supplementation early on for whatever reason, medical or not, it can create an environment in the belly that is not typical, that is abnormal. And so if we start adding other things into the gut after that period of upset, then they are going to be more likely to have further upsets from being given oral supplementation of things like vitamin D and probiotics. And I sometimes see an almost dramatic shift immediately by taking vitamin D and probiotics out of baby's routine and stopping giving it to them orally. That being said, vitamin D is still very, very important for babies. Okay, we don't get enough of it, especially here where we live in the United States. We do not get enough sunlight to produce enough vitamin D naturally for ourselves, especially now in the pandemic, how much of us are like sitting outside in the winter, right? And vitamin D can prevent our babies from developing something called rickets. It's also crucial for our immune systems and our health overall. And so we want to make sure our babies are getting it. One very well researched, and actually this is an ABM protocol, which is the Academy of Breastfeeding Medicine, which are the protocols that our pediatricians and our doctors are supposed to be following for lactation. It's written for them. The ABM protocol is for actually maternal supplementation of vitamin D. We can take vitamin D for our babies and it'll pass to them through our milk.
Well, and there's something, I'm glad you said that because, and I always share this with my moms during pregnancy too. It's like, mom, you need to focus as mom to boost up your supplies because baby will take from you whatever, and then mom is left. The other thing too, and I love that you're talking about like the probiotics with the gut, and ideally, as long as baby is, like you said, fully breastfed, they shouldn't need additional probiotics. And even with, yes, no, from
Well,
mom.
it depends.
Okay.
It depends on what happened around the time that they were born or during labor or towards the end of pregnancy.
Okay. Do you want to talk about the differences?
Yeah. So we have a very small window for establishing our microbiome in the process of birth. And once that window closes, it's shut. We can't open it again, right? And so some babies who miss that window might need some help with their microbiome and their gut function. And we probably will not be able to restore it fully but we can at least partially restore gut function and help our bodies develop a normal functioning immune system, because our guts and our immune system are connected. Our microbiome and our immune system are connected. And the microbiome is all of the bacteria that is living outside and inside of our bodies. We have bacteria everywhere, and we have specific bacteria that live in specific parts of our bodies. And where our gut is concerned, we have specific bacteria that help everything inside of our belly and help with our even our hormone regulation. And during birth, if antibiotics are administered during labor, it could affect the baby's inoculation when they're being born, right? So there's this seeding event that happens during birth where baby comes into contact with all of mom's bacteria through the vaginal canal and also through her fecal material, right? There's no accident that, the baby is born through the vagina and the anus is right here, and that we all poop during labor. I'm sorry if you didn't know, but it's true. And it's no accident, because that is where mom's actual gut bacteria comes into contact with baby during the birthing process. It's supposed to happen. It's meant to happen because it inoculates baby's microbiome. But if antibiotics are administered, that wipes our microbiomes, and it wipes the chance of our baby from having that full seeding event during the birthing process. And the longer you're on antibiotics during your labor, the less likely you are to have a healthy gut flora and microbiome present during the seeding process. Cesarean section, same thing. Not only is baby not being born through the vagina and not coming in contact with all of mom's microbiome, antibiotics are also administered prophylactically during the cesarean section. And there's evidence that shows that inoculation that baby receives, the seeding event that happens, it happens still when baby is being pulled from mother's womb. But instead of baby coming in contact and being inoculated with all of mom's bacteria, they're coming in contact with all of the bacteria in this operating room.
So Kelly, I want to have a question, because I've heard about this the last couple of years about starting to talk about, when a baby is born via C-section, to actually expose them to some of the bacteria in the vaginal canal. And I don't know.
You're talking about vaginal swabbing?
Yes. And then they put it over baby space. Is that, I'm assuming, what they do? Something like that?
Yeah. So this is something that has, in the last probably 10 years, I'm going to slap that time frame on there, maybe, that researchers have been looking into this. And people have done that, where they have inserted a swab into the vagina. And I think you're supposed to leave it in there for like an hour. You're supposed to use like a sterile swab and leave it in the vagina for about an hour, and then put it in a sterile container. And then after the baby's born, you can wipe it on their face and on their body to inoculate them with some of the vaginal flora. That being said, things change in our bodies during labor. So if we're not able to go through that laboring process, we may not have all of the same microbes in the vagina that we would have otherwise. And the bacteria inside of the vagina are only a piece of the microbiome and the bacteria that we need to come in contact with. So there's evidence that it can improve things, and there's evidence that it's actually altering babies' guts who are born by cesarean, and that there is benefit to it, but it's not an answer to fixing the lack of contact and seeding that would have happened otherwise. There's new research out there. You might not have heard about this, because this is very, very, very new, where they have been actually taking fecal matter and inoculating babies by orally feeding them fecal matter after birth, if they've not had the opportunity to come in contact with the vagina and all of the microbiome and everything during birth.
So I have not heard that, but I do know of fecal transplants.
Yes.
That I've heard of. Yes.
Yeah. So similar concept for newborns. Now, I'm not saying feed your baby poop. I'm not saying that. I'm putting
Wouldn't
that
it make, okay,
out
so
there.
I have a question though, because I feel like it would actually be better to do more of like the fecal transplant in where it's supposed to go versus orally. Because if mom has some bad stuff in her gut, that's like the only, like,
So this has been a totally controlled in a lab thing.
oh, okay, there we go.
This is new research. That's what I'm saying. Do not feed your baby poop. Do not do it.
Yeah.
Do not do it. I'm not recommending that you do it. Please do not do it. This is a very, very, very controlled thing that is done in a lab, like and I believe in a hospital setting, with researchers. This is not something that doctors are practicing. This is something that we're still looking into.
It's an interesting concept, and it definitely, again, I can see it much more from like a fecal kind of transplant perspective. When you've had mom's stool, because I do functional labs for moms, and oh my gosh, the stuff that comes back, there's always, if she's got any sort of gut symptoms, any sort of hormonal issues, we've got dysbiosis of the gut. So there's like, if we've got some bad things in the gut, we also have to make sure that like, like, I don't know. I think so. Like when baby's born vaginally, she's getting a less aggressive dose. I don't know. It's a very interesting concept. And I'm excited to see where research goes with it, because the deeper we get with the microbiome, the more everything comes back to the gut. I mean, that's what I'm doing time and time again. And even when I work with my clients who want to test their hormones, I'm like, let's test your hormones, but I need to test your gut along with it, because inevitably I'm going to get your hormone labs back. And then I'm going to be like, okay, we got to go deeper and see what's going on with your gut. So it's like, it's so all intertwined that it's just we don't need to go down a rabbit hole with it, but it's very interesting. And so I love that you brought it up just from like a science perspective, and just interesting to see where science will go with it, I guess.
Right. Well, my whole point of even going down this rabbit hole was just to say, you were talking about, should we, give baby a probiotic, or do they, if they're exclusively breastfed, do they not need a probiotic? Looking at your birth history and whether or not you had antibiotics in labor, how your baby was born, or if your baby had any antibiotics early on, because maybe they had an infection or something, or if you needed to have early or antibiotics after your baby was born. Those are reasons why considering a probiotic could be beneficial, and taking a look at our own gut health. Now, my preference is to focus on maternal gut health and maternal probiotic supplementation instead of giving it directly to baby, with the caveat that you want to be really careful with the probiotics that you're taking. You want to make sure you're taking a really high quality probiotic and you're taking the strains that are appropriate for you, right? There's
do you know what strains? I was going to ask you, do you have like the top strain or 2 or 3 that you recommend? Because I know there's so many different ones out there, so many different probiotics out there.
There is. I have I can share it with you if you don't mind me sharing something for free with your listeners.
That'd be great. Yeah.
I have a holistic guide for lactation.
Okay.
And in this guide, I talk about the vitamin D and the probiotics, and it lists the type of probiotic you want to find, and which strains you want to look for specifically.
Okay, that would be great. Yes, we will put it in the show notes, because I think this is all amazing, and moms are going to be like, but wait, what is it I'm supposed to be taking? They're like, just tell me what I'm supposed to be taking.
Yeah. And in this guide too, everything in this guide is evidence-based, and the research is there in the guide too. So you don't have to, you can go look all of this information up for yourselves as well and go down your own rabbit holes if you'd like to. But yeah, there's a bunch of stuff in the guide, some information about even iron supplementation, vitamin D, probiotics, and some other holistic things that you may want to consider when you're nursing your baby, as far as, gut function might be concerned.
Okay, Kelly. So I'm going to ask one last question, because we could talk, I know we could keep talking for hours. So this is good. It's a long one, but it's definitely so worthwhile. So is there any last things that you're like, okay, I know we've talked about a lot, but is there any last things where you're like, that you feel you'd like to share with all of our moms listening that is like a must know around any of this, breastfeeding or just health in general?
I think what I would want everybody to know is that despite what might happen early on, or despite what might happen during your birth, and maybe you don't have, the birth that you might wanted to have, or you did have antibiotics in your labor or cesarean section or any of those things, keep nursing your babies anyway. Breastfeed your baby. And even if it's not exclusively, because the more breast milk, the better. And more importantly than that, I very, very strongly believe that supported is best. And we should be loving each other and supporting each other through this process and seeking support for ourselves, especially if we don't think we need it yet, because you will at some point. And if you are struggling to get through it, go get support. Find somebody to support you and guide you. And there are a ton of ways that you can find professional lactation support. You can have your insurance cover a lactation consultant. You can see lactation consultants through WIC, Women, Infants, and Children. Or you can find support for lactation through Breastfeeding USA or Lil HA League, or come find me in my Facebook group and get support and guidance from my community. Supported is best, always. And just don't give up on your worst day.
I love that advice. So Kelly, will you share with everyone where they can reach you, find out more about you? And then I do have a question. Do you work virtually with clients, or is it only in person?
No, I don't work with in-person people at all.
Oh, you do all virtual. Oh,
yeah, I'm completely virtual, 100%
cool.
Telehealth. I have an app that people download on their phone that's HIPAA compliant, and I do telehealth lactation support. I'm actually, I'm being studied right now through researchers out of Oakland University, because I had one of the researchers had found out about me and loved what I was doing. And so the researchers there are looking into what I do and trying to show that telehealth lactation support is just as effective as in-person lactation support. And I've been telehealth long before the pandemic hit. I've been doing exclusively telehealth support for about 4 years.
Cool.
And so, yeah, you can come find me at successfulbreastfeeding.org. And I'm successful breastfeeding everywhere on Instagram at successful_breastfeeding, on Facebook, Successful Breastfeeding LLC. You can find me in my Facebook community, the Successful Breastfeeding community, my blog and podcast, also Successful Breastfeeding. I like to keep it simple.
I love it. Yes, across the board. Kelly, this has been so amazing. And I know we could keep going deeper. And so I think I'm gonna have to get you back on, and we should do a Q&A in between my prenatal moms, or like my prenatal membership and my core rehab students, and do like a combo and just get live questions from our moms. I think this is so powerful. This is stuff like, again, we talked about so much, and I'm like, I mean, and I know a lot more now than I ever did, but just listening to you, I'm like, I feel like
we just barely scratched the surface.
Oh, I know we did. I know. So I'm excited. We're going to have to definitely continue this conversation for sure. So ladies, I highly encourage you to check Kelly out. She's got such an amazing resource. I mean, one of the best now that I have found out there with breastfeeding. So grateful that our paths crossed. I know you reached out to me and we've done some stuff on your side. And so anyway, it's fun. I love these collaborations. So thank you again, Kelly, so much for joining me.
You're so welcome. This was a lot of fun. Thank you.